So this is gonna segue us into Injectables 101. Um, like I said, it's a very fun industry. It is exciting. There's new things every day. Like they just launched Skin Vive. Tomorrow morning we're gonna wake up and there's something else. It just there's just a lot. So when you come in as an entry level, you're gonna have to play a little bit and also give yourself room to grow, and then you're gonna find your own sweet spot. And your own sweet spot, like I said, there are nurses who just do lasers, and those are more like the nurses who were estheticians and they work for dermatologists and then they become RNs and they just love the skin. If you talk to Jamie, it's skin all day. It's actually funny. The first time she went to clinical, you know how depending on which nursing type you do, your personality, the things that you see, you can see somebody like I'm cardiology background, so I literally will see somebody with CHF just like that, like that's a COPD. Yeah, that's a COPD over there. That's a diabetic walking around. So anyway, she it's when I wish she could tell the joke herself. She went walk into a room and I think it was a skilled nursing, and the patient had passed overnight, and she I'm just saying this to kind of see how your brain works. Like, what do you see first when you see people? And she walked in and she's like, her color. Like, she turned to the nurse like, the patient passed away overnight. But in the hospital with like ABCs, right? You're looking at are they breathing? Do they have airway? Get a crash card. And Jamie is all skin. Like, that's just skin guru. That's just what she loves to do. So I think it's funny what we see. Now I see patients and I'm like, oh, I can do so much with Botox. I can do so much with fillers. You just like can't wait to like fix things because it gets addicting. Injecting get addicting because we have that instant gratification. If you do lips, you just see right away. You do fillers, it's instant. Botox, when they come back to see you after 2 weeks, you like, oh, okay, these things actually work, and it's really rewarding. So Botox 101, as far as aging and aging your way, it's something that we are going to do it our way. Some people like, I don't care. Some people are like, oh no, I'm fighting this to the end. Like they want 16 units of Botox. Like sometimes they even come in earlier, like 2 weeks earlier. I'm like, you still have Botox in. No, but they don't want the Botox to go off. They don't want people to know that they get it. So this is like their normal. And that's why some people who do lips, they do it twice a year or every 3-6 months. When we start aging, I love this brochure. When they made it, they came out with different ethnicities. Always look at age, ethnicity, skin texture, skin consistency. This is a work of art when you are doing injectables. Skin consistency, because you want to pick the right filler for the right area. Some are a little bit deeper, like Tiff was saying. You have fillers that you just want to go like skin boosters all the way up to on the bone. When you're doing Voluma, which is thicker, and you're looking to lift and contour, you are like playing with nature. You want to match the right. So age and ethnicity, you want to correct. There's very few times when people come and they want a Tinkerbell nose, and you're like, ethnically that's not possible. So this is surgery. And don't be afraid to say, what you're asking me to do is too risky. I do noses, but I'm very selective on what kind of noses I do, because if you put a filler, it might change, and the nose is very vascular. So getting very comfortable with the anatomy, getting very comfortable with the needles and the fillers, that will help you a lot to kind of deliver the results. But don't over promise, because then they will hold your feet to the fire. Like when they're like, oh, you put it here, I wanted it here, we had to give her one syringe for free just because that's what she wanted. Sometimes you have to eat at the cost, whatever. Everything is, we can work around most things around here. So injectables. So I was invited onto Allergan. I'm not a spokesperson for them, but I am on their diversity and inclusion board. So basically, Allergan and these companies are kind of working from the back end as far as I don't know, pop culture and aging. And as a company, they said a few years ago, they looked at their management and they're like, oh, we have products that 99.9 of our patients have cash client base is women, but in upper management, there's not that many women. And then it's like, oh, shoot. So now they're making some corrective actions and trying to promote women within the company. Same thing with ethnicities. So they are figuring out that I think we attract more Hispanic and Middle Eastern and Indian origin because the image of me on the website. I got patients drive all the way from the Bay Area. It's like, I know you're going to have a laser that's going to treat my skin. So there's a need for diversity and to also treat patients with grace and dignity. And when you're addressing looks for a woman, the young ones are more like chasing the Kardashians, but the matured women, they just want to look better. They just want to look more youthful. They're not looking to have a J-Lo jawline, or they want the, what's the name, Beyonce's chin. You know, like this, they come and they get addicted. Like everybody wants chin, everybody wants a liquid rhinoplasty, everybody wants something that Kylie Jenner did, which is good for the industry. It just bringing more diversity, it just bringing more women of color. So your branding, make sure you are sensitive to ethnicity, especially if a Hispanic woman is asking you to do PDO thread and they have big cheeks and you're like, your skin is too thick. It's too thick. Or if it's too lax and they want to do PDO thread, you're like, this is surgery. So being able to assess, there are things that we can do with injectables, what we can and cannot do. And then when to say, this is a plastic surgeon, he doesn't give me a kickback, but I hear from your budget, if you want to spend $25,000, this is somebody you want to see in Tracy. If you want something that facelifts can go all the way up to, $100,000, $200,000 facelifts. And that's, you have to be in LA to have stuff like that. So yeah, as far as injectables, we have a cap, we have a limit on what we can do, but being aware of the patient's need is a huge one. So basically, like we already talked about fillers and Botox, and we're gonna go into this different segments. Always, we already talked about consult with the patient, have that one single area that they want to be treated the most. That way they will walk away with something. And this is nursing 101. This is when you, as a nurse, if you're going to be injecting, always make sure that they see you washing your hands or using the wipey thing that we have. So make sure that they see you. So, and sometimes you say, next time, can you please not do that much makeup when you come in? Or like making sure that you clean and they clean. And some people watch you. A patient made a comment that one of my MAs didn't wash her hand in between the gloves. Well, in the hospital, we do that, So I think she worked at a clinic or hospital, and because she didn't see my MA do that physically, she called and complained. And I'm like, well, we are kind of limited on sinks, but we do have the baby wipes that we have. Has antibacterial in there. So you may not see us actually foam in and foam out, but we are very, very much aware of being clean in the area. Being aware of anxiety, some of the things we do are very painful. The most painful thing is, I think outside of the PRP in the hair, is the lips. The young ones are very confident, they just want it. It's more like the older women who are like more like pain averse and like they have anxiety about pain. So be mindful of the anxiety even before. So sometimes I have my MA hold the vibe for me if I feel like they are like wounding up. And then we have like ice packs that we put on the chest just to help them center. A few things to just let them prepare. Some people, like I am bad as a patient, so I know I'm a bad patient to inject. But anyway, it's all good. And also before and after the treatment, make sure you give them education. So Botox 101, everybody knows Botox. It sells itself. Botox is a brand name. It's a neuromodulator. It's a muscle relaxer. There are alternative uses of Botox in multiple indications. Actually, it's one of the most studied drugs right now in medicine, just because they're looking at it for anxiety. Just because when after you've relaxed the muscles in your face, you seem to take the edge off. Migraine, TMJ, frown lines. Tiff did mention there are different types of Botox in the market. There are, so I can talk about right now. So there's, I think, 5 or 6 brands of Botox right now on the market. Botox is a brand name. Neuromodulator, the second one that came on the market is Dysport. It's kind of dosed differently. So when you reconstitute, you do it differently. And then after that, Xeomin came on the market. That one you don't have to refrigerate or freeze it. And then after that, Jeuveau came out, I think 5 years ago, right on COVID. And then the newest one that came out is Daxxify. Their sales pitch on that is that it lasts twice as long as Botox. Plus, the dose is kind of like you have to double the dose. So when you do the math, if I hit you up with 100 units of Botox, you're probably going to be frozen for like 5 to 6 months. The jury's out on that. I don't carry it. I just feel like getting the right tools for the different areas. I like to do Jeuveau in a glabella complex. It tends to really work well there. I like Botox everywhere else. If somebody really wants the crow's feet gone, so people will like, so when you go to do Botox, you have to ask, which is your number one area that you need today? And they're like, oh, this one's okay. Like Tiff was saying, you always want to do a bit in the glabella complex and then a little bit in the frontalis, just because those muscles kind of depend on each other. There's a push and a pull. So being able to explain that. And always being able to say, Gifty likes to do Jeuveau here. Is that okay with you? Dysport, if they really want a crow's feet gone. Everywhere else, I like to use Botox. You can do Botox around the lips for, they call it lip flip. Although the term can be kind of like confusing. It doesn't actually flip your lip. It just relaxes the perioral muscle. And it gives you like a little bit of a little bump. It not. And some people see it, some people don't. I mean, to each their own. But it's a good. Sometimes it's like an introductory into getting Botox, like into getting other. And then once they do the lip flip twice and they see that it only lasts about 6 weeks and it didn't quite give them the results, then you talk about, you know what, filler can give you 6 months, and we can start with the smallest filler, like the very settle, soft. You don't have to get it big if you don't want it big. So being able to introduce other services and other some people we can do some lasers here on the smokers line. There are people who do not want Botox or fillers because of the stigma attached, and they feel like it's judgmental. So you kind of have to figure that out from there.